There you go.
Okay. Welcome to Circus and Changing Realities 2020, a series of virtual dialogues about the future of circus. Today, we are performing a duo, and we will be your moderators, James and Daniel. Today, we'll be talking to you from Barcelona, Spain, and we'll be very happy to be uniting forces with this great group of therapists in the circus sector.
The main focus of the panel discussion today is physical therapy solutions in times of stress. We really wanted to hear about your experiences with your circus clients over the past 2-3 months, particularly how the type of work you do may have changed in the light of the COVID-19 pandemic. We only have an hour and a lot to talk about and share, so let's start with some introductions to our distinguished panel. Please tell me your name, the country you are from and working, and your work in the circus sector. Feel free, we are gonna randomly start with, let's say, Jen Crane. Just show just on the side of us, so you can start. Jen, feel free.
Awesome, yeah, so I'm Jen Crane. I am from the US. I live in Montreal right now, so I moved here from San Francisco last year. I am a physio and also an athletic trainer, athletic therapist, depending on which country you're in. And mostly my work in the past year has been centered around education and curriculum building for circus artists specifically. My niche within the niche of circus arts has kind of fallen into flexibility. So that's what I'm most interested these days, what I'm spending most of my time talking about, discussing, teaching circus artists and coaches more about safe flexibility training and how to translate that into a sustainable long-term career. I think I answered all the questions, but I'm not entirely sure.
Stephanie, feel free. Introduce yourself, please.
Sure, I'm Stephanie Greenspan. I'm in the US, based in Oakland, California, where I teach as a physical therapy faculty at Samuel Merritt University. And then my research is around studying injuries in circus artists. So I have a 10-site epidemiology study tracking injuries in circus artists, which is ongoing now. So it's going to be interesting to see how COVID has affected the training in these circus artists, and the injuries wasn't what we were planning to capture, but we certainly will. And the other piece of my research is around motion analysis. So we've been looking at kinematics of movement in aerialists, and we were planning, although we can't do the research at the moment because of the COVID restrictions, to start looking at muscle activity with EMG with the same movement. So hopefully once we get back in the lab, we can do that. And then my physical therapy practice is all around dancers and circus artists. Outside of the academics, that's where I practice.
Atte, feel free, man. Your words.
Hello, everyone. My name is Atte Niittykangas. I'm from Finland, or actually I was from Hamburg for a while, and now I'm back to Finland from the Circ. Working with circus artists, obviously, being part of the panel, also with dancers, and also on the side of my clinic, I work in this, I don't know, how do you call it, maybe not an association maybe, but Circus 2.0. So in Finland, we're trying to do some changes in the circus, like how education side and culture side. So that's pretty interesting. So that's me, physio all the way.
Wait, last but not least, Emily, please introduce yourself.
I am a physical therapist based in the United States. I'm in Seattle, Washington. I have a private practice in Seattle, and I work with about 90% circus artists, otherwise some dancers, some other performing artists, and other movement professionals like parkour. And I also work with a couple different of the resident circus companies in Seattle. And then on the education side, I kind of work with instructors, circus instructors, to kind of help them understand the biomechanics and how the body works in the air, so they can teach with a little bit more knowledge and education about what they're talking about. And on the flip side of that, I also teach physical therapists how to work with circus artists and kind of translating their general movement knowledge to a circus body, and same idea of what to expect when they see that body flipping through the air in space.
Very, very nice. Great group of people, different minds, with the common background. Super, super cool. What should we do? Start.
Let's kick off with the first question. Yeah, thanks from me as well personally for taking the time out, because I know you've all got very busy schedules. Let's kick off with the first question, which revolves around how your work has been affected by the move indoors, by the quarantine. Obviously, we've had a period of enforced quarantine over here in Europe and for most places across the world. And certainly in my work, I've noticed that my way of working and my type of work and the type of problems the circus artists are coming to me with are a little different, particularly with regards to sort of high stress levels. So maybe we could pass that over to Jen to start things off.
Yeah, so I guess one of the big things that's changed for me is I haven't done telehealth in about a year, and I started doing telehealth again when this all happened. So I've definitely seen an interesting pattern of, I guess, I don't even know that I would group them into different injuries, but just different types of circus artists within this quarantine situation and experience. So something that I think has, like, I've seen, and I know I'm sure all of you have also seen, is that, you know, we kind of have two different types of circus artists in general. They're the ones that are going to like go big or go home on absolutely everything. And, you know, these are the ones that I see in quarantine that are, you know, they've taken every online flexibility class, they've taken every like ground-based aerial strength and conditioning workout, like they're doing all the online classes and they're coaching and just totally going to town and having to adapt to this difference in what do they qualify as training, because a lot of these artists are aerialists who can't be in the air because they don't have access to a rig. So their training is very different than it used to be. And something that I've seen a lot of is these artists who tend to just like go really big are also the ones who still now have a hard time recognizing the need for recovery, and you still need to periodize your training even though it's COVID and even though you're in quarantine, and training looks different and is giving you different stressors physiologically with your body. But also we have this huge emotional mental stress, right? So many of these artists are out of work, or you know, maybe they're hobbyists and now on the front lines providing healthcare. So it's like everyone is very different with what types of emotional and physical and mental stressors that they have. And I think that that manifests in really frustrating ways for a lot of these artists, because they don't feel like they're training a lot. They feel like they're getting deconditioned, but their body is so physiologically stressed and taxed that just it manifests really differently right now, at least from what I've seen. I'll let someone else talk because I just talked for a long time.
No, that's great. Anybody else like to chip in this moment?
You guys can just hands up.
Go for it, Emily.
Yeah, so I do have a full-time practice normally in my everyday life, and so I've seen it really shift, and it was a really interesting shift because, kind of as Jen was saying, a lot of my clients are also aerialists, and they go into quarantine. Most of them don't have a rig, or we're desperately trying to get a rig, which is virtually impossible right now. And they went from training maybe 3 or 4 days a week aerial if they were recreational, or maybe most days if they were professional, to training multiple classes a day of flexibility and handstand. And all of a sudden, I'm seeing much more transition from more the chronic shoulder injury to more acute wrist, low back, hip injuries, from seeing that transition. And these people who went from a moderate load of training of something that their bodies were familiar with to an overload of training of novel stimulus that they just weren't really prepared to handle, because they've never really done that as their only training, and they're not doing cross training. And when they're not doing their online classes, they're sitting on their bums on their computer at work, as opposed to even the basic general physical activity of walking to their car or walking to the bus stop, or just that general daily conditioning that we do as humans living in our society, they're only doing their online training, and I'm getting a lot of overuse injuries. And it's been really interesting to see kind of the curve of when people are getting appointments. At first, it was kind of low, and I had a lot of professional artists reaching out saying, okay, I'm out of work. What can we do to help my body recover and be prepared to go back to work when this is all over? I've had these ongoing injuries. I want to work on them. And then like 2-3 weeks in, all of a sudden these overload injuries from the novel training. So it's just been really interesting to kind of see those trends and see what happens as people get stressed. And there's a little bit more counseling too going on with the emotional stressors that a lot of the artists are having.
Thanks, Emily. Yeah, it certainly reflects what I've experienced as well. Definitely the last couple of weeks, I feel like my role has moved into a lot more of a sort of coaching, counseling role. So that's, I think it's something that Atte mentioned as well in one of his posts recently, like trying to predict what the role of the physiotherapist might be in the next 5-10 years, and how, you know, there's a lot more demand on us to be to have a big bunch of skills. And often it's quite hard to know where to draw the line in terms of offering mental health advice. But for sure, the last 2-3 weeks, I've been asked a whole bunch of questions that I wouldn't normally be asked, and I've been doing a lot of breathing exercises with people. Atte, anything you'd like to mention regarding?
I think there's like with Jen and Emily, I think the picture is same in what I've seen here. The mental stress is like it's more than usual. It's not uncommon to have it when you're a freelance artist. I don't think I've seen. I think for me it's too early to say if I see any pattern, like regarding if it's like overuse injuries or more acute. It's hard to say. When I was still working with the Circ, like we were preparing, like if the COVID-19 will be in Europe and like stuff like this, we could see that the stress levels were getting quite high. But then when it came and we had to shut the show down, I saw the trend in online classes like almost immediately. So so yeah, I think Jen and Emily already summarized. I'm like I've seen the same picture here.
Mike, Stephanie, anything to add?
Sure. Very similar picture in what I've been seeing as far as the transition from our aerialists to all of a sudden either picking up or increasing their training with handstands and flexibility, and so overuse type injuries related to that, as well as cross training, doing HIIT classes, walking, running, hiking, and then having hip and knee injuries that wouldn't be typical in most circus training, at least for aerialists. So a lot of that, and absolutely the mental health stuff, and that has sort of shifted. I think early on there was huge stressors, not that these have gone away, around financial, especially in the Bay Area with a high cost of living, loss of income, stress around worried about family members, especially older family members with COVID. But over time, I found that people are sort of questioning their identity. You know, this has been going on 3 months. I'm seeing people shift away, move away, and question their career because they don't know when they're going to get back. And so, you know, I have a fear that we'll lose some of these artists, but hopefully we'll come back and come back stronger. But all these pieces around mental health, and obviously we're not mental health providers, but just being able to talk and listen, that becomes a much bigger part of an appointment than it might be is just checking in on people and seeing where they are. And probably a little bit less now, but early on, just that loss of human connection, people that live by themselves and don't have a way to interact, or overload on social media from constantly reading about COVID, and now with stuff with racial injustice where people are just, they can't get off and they can't get away, and they're getting very emotional about reactions from friends. So all of that mental health aspect manifesting in what's going on with their physical health too. So that's definitely a huge component too. And I think the one other piece too is just nutrition components. People afraid because their training has changed. And like Emily was talking about, just that general physical activity. I'm not like walking places and out and about just in my normal life, concerned about weight gain and performing artists. And then we all got into the comfort food and baking, right? when we were on home restriction. And so concerns about that. And then also food access for folks, because sometimes the same foods that you normally eat aren't available or easily available. So I think those would be the pieces I would add.
Thanks, Stephanie. That's great. I mean, you guys have already going into the second question, talking a little bit about trends and differences in training, and not only training but injuries as well. What I would like to know from you is, maybe going a little bit out of what we have on the schedule, is, do you normally, as James was saying, that he get asked a lot of questions that he was not asked in the past, do you guys normally do the traditional approach with these sort of new injuries, these sort of new training routines? Do you normally do a different approach nowadays, or do you do the traditional approach from the perspective of active and passive? And not only that, but going into more like psychological details from what they can get from the injuries or even pains that maybe doesn't come from structural injuries. So I'm not sure if I made myself clear, but
looking like if your assessment methods now may have changed, and you're considering other elements and other factors,
exactly,
like their sleep quality, their emotional status,
exactly,
if they're getting pains that aren't necessarily from a traumatic injury.
That's it.
Stuff like this.
So instead of seeing all of the complaints as straight as an injury, a structural injury, if the symptoms are coming from something else other than structural injury, maybe the lack of adaptation to the new training routine, this sort of stuff. So who would like to start? You can raise your hand. Stephanie.
I'll start off. I think for me, pain, it sounds to me like you're talking just about the concept around pain science and the fact that our injuries, our pain is not always from a structural thing, that there's, psychological, there's immunological aspects and many others that affect that. So I think that's always a component for me, and that I'm considering. And often just with a circus artist or any professional that gets an injury that's related to your career, often that pain you're going to feel is going to be magnified by the importance and the potential consequence of an injury. Is this going to end my career? So I would say the psychological aspects are certainly magnified right now because you're layering that fear about their potential ability to continue their career with, are they going to be able to continue their career because is there going to be an opportunity to perform? Are we ever going to be able to sit people in a theater again? And all of those pieces. So I think I'm looking at the same things, but I'm finding that those components are magnifying symptoms in a way that we wouldn't across the board see the stress in patients. So I wouldn't say I've changed how I assess, but I definitely spend more time talking about the mental health and checking in on all those things. Absolutely sleep. Some people are sleeping a lot because they're depressed or because they don't have to be up for anything. Or some people can't sleep because they're online looking at all this stuff that's going on in the world. So you see both ends of those spectrums. So sleep, nutrition, mental health. I probably more consistently assess those things in patients right now across the board than I would because it seems like there isn't anybody who isn't affected right now.
Anyone else would like to comment? Yeah, go for it, Emily.
I'm just going to basically agree with Stephanie. I've been asking those questions a lot and spending more time on the answers and really focusing in on their perceptions of their injury and what their worries are around that injury, instead of asking, you know, how does it affect your training? I'm like, what are your concerns about this going forward? What are your goals with your injury? And kind of just redirecting the questions a little bit and spending a little more time there. But yeah, there's just a lot going on. So I'm not changing so much what I'm doing, just kind of changing the focus and kind of counseling them through that a little bit more, whether it's on the mental health side of how this might affect your life, or just on the condition that they actually have, and helping them understand that this injury may not be career ending, here's why, and really giving them the education around the injury itself.
Go for it, Atte.
Yeah, I like the term like magnified. Like I don't either change a lot how I work, but maybe some coaching aspects are more highlighted at the moment. For example, I think aerials are a good example, because they need a rig. They need to, like, if they don't have an access to their apparatus, it's a huge dilemma. I'm optimistic always, so I also see a good sign. Like if an aerialist comes to my clinic and we talk, like, okay, you can't do your weekly 7 days a week aerial training, so what do we do with the time? We have good time to also like change, maybe improve their work training habits. Like, okay, maybe you should train less apparatus. I will add a bit of strength training here. More like, I don't know, I think coaching is the term. Like more like looking at the big picture, how much you train, this much is like important, and this much you need to maintain your level, like 3 months. If like exercise physiology wise, you really don't lose that much. You don't lose your skills, you don't lose your strength. You can maintain it quite easily. So like more like maybe also giving hope, like even if this would last 6 or 12 months, we can still survive, and this is how you will do it. So I think this is also good. There's always something positive in this huge, like, stressful time.
Sure.
Yeah, I think to echo some of what has been said already, something that's really encouraging that I've seen kind of generally throughout the circus community right now is, or at least, I mean, right now, I feel like everything is so focused on the charged politics that I'm trying to like remember what it was a couple of weeks ago. But I saw a trend towards this like self-care, which is great, right? Like circus artists are already very intrinsically motivated people to heal from an injury, but now I'm seeing a lot of people being really proactive with like, okay, I have this time, I am not working, I have some savings, I want to, you know, invest this in my health, and how can I, you know, finally address the back pain that I've had for years, but like it was never bad enough to actually warrant going to the doctor, the physio, but like maybe now's a good time to address that. And I've seen some really good dialogue around self-care and kind of this more preventive medicine that we've been trying to move towards for such a long time as a profession on the whole. So that's been encouraging.
Very nice.
Thanks, Jen. I think what we'd like to do in the second half of the conversation, especially for people listening to the discussion and looking out for, you know, what advice and what tips, you know, the physical therapist can give with this specialty in circus, because so many people often, you know, drop into clinic and say it's so hard to find someone that understands what I do. They've seen a number of therapists and they're not really getting any. They don't really have that confidence with the advice that they're getting from non-specialist physiotherapists or even some sports therapists. So I guess we can move the conversation into something really practical about top tips, things we can actually offer advice and tips to circus practitioners, to students, to pros, to get themselves sort of safely back into training, back into their sort of normal routine. I think, Jen, what you touched on with regards to people looking for self-care, I think it's a great thing, and I think it would be good to not lose the momentum, because so often people come in for a treatment, a fix, and it's obviously not about that. It's about longevity. It's about keeping your body as healthy and safe as possible for your whole career and beyond. So maybe we could divide it into two topics. I'm not sure if you've all done some telehealth or some virtual consultations. Maybe we could hear from I think most of you, I think Stephanie and Emily, you both said you were doing on Instagram, some telehealth, some consultations. Maybe we could hear from you guys first to see how that went and what sort of limitations you found with that. Was that sort of mechanism of assessment and sort of treatment without, you know, someone being actually present? Do you want to kick off, Emily?
Sorry, Stephanie and I were just doing like the whole eye communication, body language thing.
You'll be.
Figured it out. Yes, so I've been doing all telehealth for the last, about 3 months, almost exactly. I am switching back to some in person starting tomorrow. So that'll be very interesting as well. I saw a couple a few weeks ago, but otherwise it's been all online. It has been really interesting. I come from a movement analysis background. That's kind of where my training comes from. And that's been really helpful for this transition to telehealth because I primarily am looking at movement and movement patterns. I'm able to translate that pretty well to online. I definitely miss my manual muscle testing, actually knowing the strength of an actual muscle versus guessing from movement. So it's like, is the muscle, I like to say, is the muscle strong but dumb? Or is it dumb and weak? You know, is it that the artist can't fire the muscle, or that the muscle is actually, you know, but the muscle's strong and they're using it for something? Or is it that the muscle is actually weak and they can't use it? So being able to make that distinction has been harder, but watching their movement has been relatively the same. And it's been interesting to try to translate my brain from 3 dimensions to 2 dimensions. I now have even more respect for all the movement teachers out there trying to watch multiple screens of their Zoom and teach and watch that many bodies, because it does take a lot more attention. It is more exhausting at the end of the day to try to extrapolate 3 dimensions from a 2-dimensional image. And I can't imagine doing it in a group format. So very much respect to all the circus and dance teachers out there who are doing that. But it's generally gone pretty well. I feel like my artists have been happy and getting results and making gains and transitions. And that because we're doing so much coaching and education, there's a lot of that can happen with the telehealth format as well.
Stephanie, would you like to?
Sure, I'll tap onto that. So yeah, I think one of the challenges with looking at movement is when you're with someone, you can walk around them and see from any angle. So that, like, asking them to change their position or change the camera, put it higher, put it lower is a bit time consuming in a visit. And, you know, we often use video, but it's different than live streaming something. So you can't slow it down in real time when you're looking at people over a Zoom visit. And sometimes, you know, things that I would put my hands on to palpate and see that are hard to see, you know, where a bone actually is, where the scapula is under the skin, that sort of thing you can't do. So those things are definitely challenging, and definitely things like palpation or joint assessment or muscle testing I often would like to do. But I'm finding that certainly we can get most of the picture with a telehealth online visit. There have been a few times where I'm trying to differentiate a structure that maybe is a source, especially related to the injury study, that, you know, doing a couple things hands-on would have taken it that 10% further to make me confident. But for the most part, I feel comfortable with that ability to figure out structures. And certainly teaching movement and exercise is fine in that format. So I find that we can do most things. We can't hug people, and that's a bummer, especially right now. So because they need that. But we can do a lot. And what I've found with PTs, I've transitioned everybody in the research team, and Emily's part of my research team, to doing telehealth, so training people on telehealth for our injury study. As a physical therapy instructor, we do these pro bono clinics, and we've transitioned students online and faculty online. And what I found, and everybody was skeptical, not everybody, but people who hadn't experienced it. And I think everybody is surprised at how well it works. And that happens too on the patient side, where I think a lot of practitioners in performing arts have found that their patients went away, they didn't want to do telehealth because they didn't think it would work. You can't put your hands on me. You can't do the manual therapy part. So a lot of clinicians saw a drop in attendance because of that. They had people not wanting to transition. But when you get people to come over, I think everybody's pleasantly surprised at how effective telehealth can be. And so that's good news for right now, because we're stuck with it for a bit. But I think it'll also change how we practice, and what you were bringing up about access to people that understand circus artists. I mean, we do have restrictions as far as licensing and legal restrictions to practice across the country with telehealth, and hopefully those will change someday, because it does give people access to expertise they wouldn't have near them. And so I think that's a really powerful opportunity with telehealth.
I just actually wanted to ask. I wanted to ask Stephanie a question, if I can.
Yeah, sure. Go.
I was really curious because you said you're translating your pro bono clinic with your students to online. I'm assuming the students are working with a faculty member as well, but I'm wondering whether you've noticed that the students' observational skills have actually improved, or whether it's just been a really big challenge for them.
Yeah, interesting question. Yeah, absolutely. And we had a transition first years who've never done a full thing in person on anybody to online. And if anybody was scared, they were. And they've done great. And I think what they're finding is they can't rely on their hands. So their observation skills are getting better, their ability to explain things verbally and cue people that way. So it's making them hone other skills. And not rely on touch, which is a challenge and an opportunity.
There's one comment that, yes, Jen, go ahead.
Yeah, so I just wanted to quickly add on also, I think that it's interesting to see what these circus artists want from telehealth. That's, I mean, always the first thing that I ask is like, hey, what do you want? Like, what's like one thing that you really want from this visit? And the answers are very different than what I get when I was in San Francisco and I had my physical practice. It was very different. People have very different goals from telehealth, and I'm finding that a lot of these artists want, like we were alluding to before, they don't have access to a physio or a sports medicine provider who understands what they need to do and how their bodies need to work. And now this is a really, it's a good opportunity for a lot of these artists to be like, oh, like I might as well, because this is my only option. And I've had all of these questions that I haven't been able to ask anybody that really affect my training life and my, the way that I can use my body. And I think that that's something that's been really cool to see what the priority is for these artists as well. So.
And I just add on to that too. I think it makes our patients more independent because we can't do the passive things. So they have to take a bit more responsibility and also directing the assessment and setting up their assessment and sometimes palpating themselves. And so they become a bit more, they take a bit more ownership over things. And I think that's a positive effect too.
It is actually supported by science, right? I mean, all of the things that I have been reading recently, they say that self-treatment or self-care, let's say, it's what we are kind of aiming instead of only relying on passive techniques or only passive care. And one of the things that I was about to add before is that it seems that research also supports telehealth. It seems that the results are very similar to face-to-face appointments. So that's pretty interesting to see that it's something that we are forced to do. It's already supported by evidence, which, I mean, I'm a big fan of science, so I'm always really excited when I hear something like that. Hey, Atte, sorry, man. Sorry, you were discussing before how we should pronounce your name, so it was a big thing before. So sorry for that. Atte, would you like to add something else to telehealth or the way that you approach to your clients?
I think like all the ideas have already been said. Like I find it it has a positive effect on how physiotherapy in general is like prioritized. Like if you're all hands-on, now you have to think of like new ways. And I'm totally agreeing with this, like that people take ownership, like the questions that we're usually discussing. I think like what I think is the priority is like how much you train. Like, okay, I get this back pain, but like the training loads are too much. So we have more time to discuss this, which is actually more impactful for most of my clients than like, okay, here's a very cool exercise I just came up with, and you should do it like exactly like this, and you need me to show it to you in person. Like I think it's the priorities, like going in the right way with the telehealth.
Yeah, I think the educational component that we're able to do in that closed one-way chat, two-way chat has been really helpful. And that concept of self-efficacy, that idea that you have to take ownership of your own goals, is kind of the pinnacle of care, to allow people to really take that knowledge and that skill and take it within themselves, so that they can train themselves and just come back with questions occasionally instead of hopefully more pain.
Thanks, guys. Yeah, all really interesting. And I was curious because during the quarantine, I was about 2 weeks in. That was about 7 weeks ago here for us in Spain. And I was getting a number of questions from clients about what they could do to keep themselves, at least maintain their level of fitness. And I performed some online consultations, but it was pretty difficult just from a logistic point of view, having a lot of family at home. I was actually stuck at home with my 2 cousins, and we had like 5 people in the house in a very small flat. So it was pretty difficult just from a practical perspective. So we set up a small online questionnaire, which was looking at training habits following the move indoors. And we tagged in a question at the end, which was trying to look for people's drive and looking at their motivation, which revealed some really interesting things. And essentially about 90% of the respondents were suggesting that their motivation had dipped or or was going up and down. But there were 10% that were like super confident, super positive, had used the time constructively to find enjoyment and sort of pleasure in other things. And they were sort of suggesting that they were very resilient and very adaptable, and that, it's just, let's make the best of the situation. But still, I'm finding, having only gone back to sort of face-to-face appointments over the past 3 weeks, I'm still getting a lot of requests for people that are too fearful to actually venture out of their house to come in for appointments. That kind of takes us into the next question, which is what sort of advice or tips we can give to circus practitioners that have noticed a deterioration in their physical or mental health. Any sort of top tips or any guidance?
I'll start us off, but I think it's just reach out. I think people haven't reached out in part because of this whole telehealth, and if they can't put their hands on me and do things in person, is it going to work? Has been a barrier, and that's becoming less so as there has been less of a opportunity to have in person. But to reach out and take care of themselves on a mental health aspect, on a physical aspect, and finances obviously are another barrier for circus artists that are out of work right now. But reaching out, asking people about sliding scales, looking for for example, in the Bay Area, we have a healthy dancer clinic, which I'm always trying to get circus artists to come to as well. And there are a lot of therapists. Our performing arts SIG through the American Physical Therapy Association has tried to create a network too of PTs that are offering free visits to help performing artists that are out of work. So rather than assume that someone's not going to help you because you can't pay, to reach out and ask, either for a sliding scale or for pro bono opportunities.
I just wanted to jump in with Stephanie just because in Seattle, we have the same thing. We have a free artist clinic. I'm on the board of an organization called Seattle Dance and Performing Arts Medicine. You get to be seen by a physician and a physical therapist. We are moving online next month as well. So hopefully we'll send that resource out the links for this and the Healthy Dancer Clinic as well, so people have those.
So something as far as like an actionable tip for circus artists right now, I think, which is a very boring tip, but I think it's really, really valuable, is like, life is really overwhelming right now. There's a ton of stuff going on in the world, and it's all really like, there are a lot of very charged emotions right now, and that's probably not going to go away anytime soon. And like anytime, like there's so much to think about and so much to do, and like everyone knows all these rehab exercises, and like how do you prioritize? And before even getting into all of that, it's like, go back to the basics. Like, what are the foundations? Sleep, nutrition, hydration. Pick those 3 things and like focus on one thing that you're really bad at. I'm really bad at drinking water, so I bought a soda stream because I will drink carbonated water more often than I will drink flat water. Find something that helps you improve one of those 3 arenas and work on it, because that will help absolutely everything else. So that's always my favorite, boring but very helpful tip.
That's a great tip. I mean, people often forget the basics, right? So people often are quite quick to jump in. They get overwhelmed by their Instagram feed offering this online course. They're often comparing themselves with their friends about, who's doing what, how much have you done, how many hands have you done, and it's not good, not healthy to compare and freak out. As Jane was saying, I would agree completely. Stick with the basics. Make sure you get good sleep quality, good hydration, and eat well. And then your immune system is going to be in a better position to deal with anything that's thrown at it.
I would like to add something as well. I mean, one of the things that I see is that a lot of the people that I see, a lot of the artists that I see, they're really worried about the situation, especially now that they're starting to come back with the training, because in Barcelona, the training facilities are starting to open, I think, last week. Yeah. So you can already see some of them getting injury because they basically want to jump back to their same routine as before, the same volume as before, as Atte was saying. So one of the things that I would like to say is take your time. Don't freak out with things that, if they don't have a very clear history that explains your pain in a way that there is a fracture, or not a fracture, sorry, a trauma or something like it, do not freak out to start with. Always, and as Stephanie and Emily were saying, is that you can always reach out for people that are willing to help, or just to give you an advice, or just to clarify a little bit what you're feeling in symptoms. So just reach out to your trustable circus physio or healthcare provider, and just ask. I mean, ask doesn't hurt, so asking will not hurt anyone,
In terms of volume, a lot of people are asking me in terms of training volume, what should they be aiming for in week 1? And obviously it depends on what your training volume was like pre-quarantine and how much you've done during. But my suggestion is to go about 50% less than you think, and then see how you feel the next day. That's my general rule. So it's about a sort of scale down about 70%, and then just let week 1, learn from your body and try and increase your awareness. I've been talking a lot with people about allowing themselves to sort of tune in with their awareness and actually listen to what their body's telling them. Listen to their internal dialogue. When they wake up in the morning, what are they thinking about? And why they're thinking about that? Is it from what was the situation or the feelings they had when they went to sleep? Is that going to affect how they feel when they wake up? And getting your mind into a position where before you start your training, that you have some sort of clarity, even if it means just taking 5 minutes out in your warm-up alone and doing some sort of exercise routine, some sort of breathing routine, anything that's going to kind of make you feel more consolidated and more centered. Go, Emily.
I lost my mouse for a second. Yeah, so as you were saying about kind of where to come back in training loads, the Australian Institute of Sport in 2015 came out with an equation that they were kind of looking at. So I can, again, send that in the information, but it's a calculation of weeks that you've had off. I'm looking at it, sorry. Weeks that you've had off, the percentage of training load that you've kind of been doing while you're on that break. So are you doing about 20%? So maybe you're doing some strength training or some walking, but not, getting in the air. Or you're doing more like 80%, you have a rig in your backyard, you just don't have structured training. And you take that number and there's an equation and multiply it and figure out kind of where you should be and kind of how many weeks it should take you to get back to where you were. So it kind of helps give a little bit of a guide, and it'll be interesting to see if people apply it, how accurate it kind of is. But it was something in 2015.
I think that something that's also really interesting to think about and just anticipate ahead of time is so many of these artists, like, they're going to go back, and then after the first week, they're just going to be so depressed and so upset because they lost strength, they lost their skills, they maybe are having a hard time even enjoying it because of all of those reasons. I mean, this is really going to be the same scenario as coming back from a longer term injury where it's hard to go back. It's really hard to know where you were 3 months ago and know that you're not going to be there whenever your space opens up again. And I think something that I found really helpful personally and with my circus artists in the past is encouraging them for the first couple weeks. Your goal of training is to enjoy training. Find something, your goal shouldn't be to do get back to as many pull-ups or inversions or whatever as before. It shouldn't be a strength-based goal. It should be think about your mental health. How are you gonna take care of your mental health knowing that this is going to be a hard transition? How can you preemptively get ahead of all of that and set yourself up for a little more success? So, I mean, I love, as much as the next physio, objective goal, short-term goals, long-term goals based on strength, based on range of motion. But I think that this is probably a scenario when we need to step back and have a broader perspective on what are the goals.
Kind of with what Jen's saying, one of the unique things about this versus coming back from an injury is almost everyone's in the same boat. So if I could give one big tip to everyone as you go back into the studio is be kind to everyone, try to have patience with everyone, and take care of yourself and your community. We have a great, wonderful, supportive community in general, and it's time to really take care of each other.
Atte, did you want to jump in?
Yeah, I just like maybe some practical tips, like the amount of training you need to maintain your strength, for example, it's actually quite little. I'm not gonna try to give you I give approximates, it's something like 12 to 15 days. You have to do one heavy strength training, and that'll maintain it for the next 12 to 15 days. So it's not every day. It's not you don't have to maintaining your skills and maintaining your strength and fitness is actually quite easy. There's the hard work you did it already to get there. So maintaining it during COVID it's not that big hard. So just please please just don't I don't want people to get too stressed that they should be doing more and more, like many of you I think mentioned it, seeing in Instagram oh, he or she did 17 exercises last week and I did none, I feel bad about it. So this is yeah, that's the downside of Instagram. Science wise, 12 to 15 days, one good strength training and you'll be good. If you're aerialist, it should be upper body and yeah.
Yeah, I wanted to add in, and I've brought this up for just the period while we are shelter in place too, is just using motor imagery. So your body might not be ready to go do all of your skills, but using motor imagery to get your silk sprain or whatever your apparatus is, get that back and thinking about sequencing and thinking about movement. So maybe do a little bit of physical activity and use that to help get your brain back around your apparatus or your skills. And you can, also use that from a creative side of thinking, to get that piece of your identity back and thinking about creative. I mean, we've all come up with choreography when we're in the car or, in the shower or things like that. And so using imagery for those reasons to sort of balance that desire to get up and do all that physical activity and then ending up back in the same situation because you're injured.
Some really nice tips there, and I think the
overwhelmingly a good thing to remind everybody, as Emily was saying, is that we're all in the same situation. No one has robotic or supersonic or crazy unhuman abilities. So really important to, as Jen was saying, just enjoy your training. Enjoy the first 1 or 2 weeks, and if you are more science oriented and you want something a bit more objective, for sure, the algorithm or the formula that Emily could post would be really useful to look at as well. And obviously listening to your body, listening for the whispers your body's telling you. You pretty much know when you're pushing it a little bit too hard, too fast. And to go in easy and to be kind to yourself and to others around you, for sure. There's still going to be issues with sort of social distancing and training and having space in between sort of training areas. But we're going to work that out bit by bit. At this point, we're coming to the end of the session. So is there anything before we start the goodbyes, anything that anybody would like to pitch in, any particular statements you'd like to make regarding this topic of sort of staying healthy, sort of during and post-quarantine, as a general conclusion?
I was thinking about this along the lines of what we were just talking about, getting back. Everybody's been really missing their community. And as much as we've been reaching out on Zoom and things like that, it's not the same. So I think even as part of your enjoyment of being back and getting back to what you love is just getting to see your community in person, even if you can't hug them yet. But I think that's an important part that we've all been missing. And that's an important piece for mental health. And so really cherishing the ability to be together again as a community in person.
Absolutely. That sense of tribe, community is very strong in circus. So it'll be something that's be really good to get back as soon as possible. Atte.
Yeah, I just like always the optimist. Your skills will not go anywhere. If you maintain some sort of fitness, your skills will last like your lifetime. So also, like, people are like, I've trained 3 disciplines and I need to be good in everything. So no, you can take a pause from discipline. It will be good for you. So when you get back, your skills will be a bit rusty, but they will be there. You will not lose your handstand like in 3 months. No worries.
Absolutely. It's a really important point, right? Because people, especially the younger students or the sort of novice, new to professional circus arts, is this fear of losing everything. Like, I've worked so hard to get to this point, and this real fear of having lost everything. But yeah, it's really important to stress that you might be rusty, but those neural pathways are still there. They're going to be a little rusty, but it will be, you'll be back to sort of the same level of technique and tricks as you were very, very quickly, for sure.
As Stephanie said, I mean, there's a lot of things that maybe the circus community are not aware that they can do to basically maintain at least the motor ingrained of the things that they have rehearsed and worked for such a long time. So use it as an opportunity. That's what I normally tell my circus clients that come and cannot perform the way that they used to perform before coming to the clinic, is basically use this as an opportunity to learn something new, to learn something that you wouldn't do if you were not injured. So we can see it, I mean, from all of the things that happen in our lives, we can see it as only with the negative perspective, but we can always see it as something new and creative and take it it's not that the thing itself will give you or offer you something, but if you work out, you can always take something from it. So use this as an opportunity to try new stuff, different things, basically.
Anybody else like to jump in just with a sort of concluding statement? We're all good. So I think it's time to wrap it up. I think it's brought up a lot of interesting topics. It will be really interesting to meet again, perhaps sort of 2 months in, to see how the 2 months from this conversation has how things are. I mean, there's so much happening right now. It's quite hard to stay just on this topic. But I want to thank all the panelists today for coming and for sharing their perspectives on the COVID-19 response from the circus world. I think this will be the Instagram names of each of the panelists will be available on the video, I think, which will be live from June 16th. And one more thing to mention is a big thank you to CircusTalk for hosting this panel as part of their series, Circus and Changing Realities 2020. Those of you who may not know, CircusTalk is an inclusive, independent and international online network for the circus industry. CircusTalk offers jobs and event listings and up-to-date news about everything circus. And as a response to the pandemic and its effect to the industry, now CircusTalk offers a 60% reduction on their annual pro membership subscription with the coupon code COVID-19 yearly. Thank you all very much again for participating, and hope to see you all soon.
Thank you all, guys. I mean, the ones that are in the US probably have woken up really early. So thank you so much for making the effort to be here with us. For us here in Europe, it's really comfortable, actually. So really, from the heart, thank you so much for taking part in the event.
Thank you guys so much for organizing. Yeah.